that. And we are hearing that the COVID-19 numbers have just been released. Bear with me, I'm going to find it. Here we go. Here it is. We have recorded 19,840 new cases nationally. There were 73,911 tests conducted, a 26.8% positivity rate right now. Gauteng, again recording the highest amount of new infections at 11,703. KwaZulu-Natal in at 1,989 and the Western Cape at 1,899. We can get more on this. We're talking to Mosa Moshabela, the Professor, Deputy Vice-Chancellor of Research and Innovation at UKZN. Prof, thanks for your time. We appreciate it. We're almost at 20,000 new infections in the past 24-hour period. It is getting quite concerning. What do you make of these numbers?
Yes, greetings, Shahan, and to the viewers. I think that much of what we are seeing, I would say that, we have been sort of beginning to predict in the past couple of weeks, including the fact that we are likely to see a large number of cases. The question is going to be whether those cases are either going to become severe, and we are seeing that increasing evidence is starting to converge around the fact that we may not be seeing as severe cases as we were worried about. And the second thing is whether just the sheer number of cases might eventually become problematic and begin to overwhelm the health system. And we are waiting to see that. If the cases are as mild as or moderate as they seem, we may be able to get past the fourth wave with this Omicron variant. But I would say that the numbers are indeed concerning. It's reassuring a bit at the moment that even with the high numbers today, the positivity rate is still at about 25-26%. So we have to see the rest of this week.
And then, of course, you look at the number of deaths per day recorded as well, right, to actually determine how severe this Omicron variant is.
Yes, no, absolutely. I think that it's been really a little bit reassuring to see that they are not increasing as much as we were concerned. But as we all know, we have to give it time to actually really see what the numbers are. People who are also looking at excess deaths are reporting that the numbers are actually looking a little bit more reassuring compared to previous waves. So again, we are seeing a little bit of convergence of evidence that suggests that we may not be seeing as much death as we have seen in the past. But again, I'm saying this with extreme caution, because it's still very preliminary data. Yeah.
All right, Prof, let's talk about SAHPRA approving the booster shot for the Pfizer vaccine. And it's very important because Pfizer actually released information just today saying that a study they've conducted on Omicron shows that there is improved protection for those who do get a third dose of their vaccine against this new variant.
Yeah, I think firstly, in terms of SAHPRA, it's really good news, especially because we've been wanting the Pfizer vaccine to become available for people who have conditions that are associated with weak immune systems, as well as people who are 60 years and above. So that's really good news. And it means that we could begin to make the booster shots for those groups or additional doses for those groups available. What was a little bit disappointing for me was the fact that SAHPRA remained neutral about the issue of mix and match, essentially saying that they didn't have the evidence to review that request, recognizing that a lot of people are interested in the mix and match of Pfizer after J&J. So there's no conclusion there, unfortunately. But just to say that I think for the Pfizer booster data, that data, in as much as it's coming from Pfizer and one could look at it with suspect, it's actually quite interesting because it converges with some other data that just came out last night from our groups in South Africa and some groups in Europe that are showing that actually what we are seeing with Omicron, it means that the booster might actually provide more protection. And only the 2 doses of Pfizer will protect partial protection, will protect from severe disease, may protect from severe disease, but certainly a booster might be additionally beneficial.
Yeah, I see that SAPRA in their statement saying that the so-called mix and match approach, they're still waiting for invites and submissions and supportive data on that before they can come to any determination. But let me talk to you about the processes now, given that SAPRA has given the approval for a third dose of Pfizer. Government needs to come in here, right, to actually say that citizens can get that third jab. And do you think, given our vaccination rate right now, if we should go that way right now?
Yeah, I think that indeed it's important to make a distinction between what SAPRA does. SAPRA really just allows, opens up the policy space to make this possible. But we know that the Ministry of Health has already been preparing the policy document for boosters or additional doses for people who have immunosuppression. So that I suspect that will probably happen, almost immediately. But I think that the sense that the sentiment that is expressed by the Ministry of Health around people who are 60 and above, which is going to have a few people disappointed, is that they are looking at probably January for 60 plus. It may be that some people who were initiated early on might begin to get their boosters who are 60 plus, but the sense was that this could really be taking off back later in January. So that might be a little bit disappointing. And so, yeah, indeed, I think that for everyone else, I think we just need to know that that is not yet approved, except for those two groups.
Yeah, so Prof, would you encourage government then to look at the option of actually doing the third dose sooner than 6 months, especially for those who are immunocompromised?
Yeah, so for those who have conditions that are associated with immunosuppression, then, the approval says that they can get it, within 2 months of their vaccination. So they can get it earlier. It's only those who are 60 plus that they have to wait 6 months. So I do think that, there will be a distinction made. And for those who have medical conditions that require an additional dose, they can probably get it right away.
Yeah. All right. Thank you so much for your time and your insight. Appreciate it. Professor Mosa Moshabela, Deputy Vice-Chancellor of Research and Innovation at UKZN.